At the Milton Cato Memorial Hospital, and it is May 5th, Mayo de Cinco, and it is World Hand Hygiene Day. And we have the infection prevention control team here. Will be doing an activity in the hospital to help to bring this awareness to persons about the importance of hand hygiene. So we're going to talk to Dr. Davy, who is the registrar responsible for infection control, among other things. And she will just give us a little synopsis of what is happening here today and the importance of all this pretty train.
Hello, Nika. We are happy to be here today on the 5th of May to celebrate World Hand Hygiene Day. The theme this year is Fighting Antibiotic Resistance. It's in your hands. Last year saw us celebrating another theme, which we did with the public at the post office. But this year, because of the theme, we've decided to keep our activities in-house. So we are going throughout the hospital with our infection prevention control train, reminding the staff of the importance of hand hygiene.
Okay.
So we'll be going to the wards, both now in the morning and in the afternoon, reminding the staff of the importance of hand hygiene.
All right, so Sister Primus, give us your take on today's activity and the synopsis behind it.
Okay, basically we want the staff to know the importance of hand hygiene, and not only to know but to be able to practice or perform the correct procedure. And according to the theme, Fight Antibiotic Resistance, it's in your hands. Many of the resistant organisms, they are transferred by hands that are not clean or not washed properly. So we need persons to be able to perform this procedure so that they can keep themselves healthy, prevent themselves from developing infections. These infections can be passed on from healthcare workers to patients, patients to patients, and the patients to healthcare workers. So it is important that we understand the importance of hand hygiene, and really the use of antibiotics, if not properly used, can also contribute to the rise in this type of resistant organism. So hand hygiene, it is the simplest and most effective way of preventing the spread of infection. So we need everyone to know and to practice the proper procedure.
So essentially this activity, of course we have some medical students that are here to support the team, and we're very grateful for you guys. Thank you. This exercise, is it going to just target healthcare workers, or is it going to target everybody?
Okay, our main focus is on healthcare workers, but at the same time, patients are in the hospital. They need to understand and to know the procedure for hand washing, visitors, relatives who come, because they also can bring infectious organisms on their hands. So it is important that they too know the procedure so that they can help to prevent the spread of infection.
Okay. There you have it, guys. So we're about to do the tour throughout the hospital where the infection prevention control team will be going around and doing their activity. So the train has stopped at the maternity ward, and the staff are here and eager and ready to be a part of this quiz section. I'm confident that they would know all the answers. I hope, fingers crossed. So Sister Primus will be the one who will be asking the questions, and then we'll see how bright our doctors and nurses are.
Okay, at this time I'm going to ask you about the 5 moments for hand hygiene. Because even though we are saying that hand hygiene is important, it should be done at specific times, and we need to ensure that we know those times so that we can protect our patients from developing infections. So, first, the first one, who can tell me what is the first moment for hand hygiene? Yes?
Before coming into contact with the patient.
And could you give me the reason? Tell me why you would want to wash your hands at that point?
And because we may have germs carried around in our hands, so in order to protect the patient, we wash our hands so as to prevent the transfer of germs towards patients. So it's protecting the patient.
Awesome sauce.
The second moment?
Second moment.
Yes.
Before is septic technique, so as well you have germs on your hands, so you want to protect the patient from those germs as well as the germs that are on the patient.
Very good. The third moment? Yes.
That's after exposure to any body fluids, and that's just to protect yourself from any risks the patient carries.
Yes, that is so true. The fourth moment for hand hygiene?
After patient contact.
And why?
Well, you have to also protect yourself
You have to protect the patient as well as protecting yourself. So you always have to wash your hands. So you want to carry germs from one patient to another patient. So it's important that you wash your hand after each patient.
Very good. And the final moment, the fifth moment for hand hygiene.
So after contact with the patient's surroundings, the reason being there may be bacterial germs that are on different surfaces around the patient, and you may transfer those germs to either yourself or other patients, and you want to prevent that.
Now, it's not only good enough to know the 5 moments, but we need to actually know the procedure for hand hygiene. So at this time, we're going to demonstrate the hand hygiene procedure to ensure that we are following the proper procedure so that our hands will be rendered clean before we contact with the patient or the environment.
So Staff Nurse Providence is going to do the hand washing technique demonstration, and she's going to be assisted, or she's going to do it alongside a doctor and a nurse.
Okay, so the procedure is first we need to get all the things in place. So we need to have running water, we need to have the soap, and of course the tissue for drying the hands. Okay, so the first step is to we turn on the pipe. Once we turn on the pipe, we want to wet the hands. Okay, so I'm going to wet the hands and you will do the same. And the reason why we wet the hand is because we want the soap liquid to be able to get onto the hand so that we can lather properly. Okay, so we apply the soap. Just inside, so you rub it on top just to have a lather. Okay? So once we have the lather, we're going to start to wash. Okay? So, in between the fingers. Then we switch. We're going to switch hands. We're going back to the palm of the hand. So we're going into the fingers again. Then we're going to cup the hand, the fingers, and we're going to, like we're washing.
Is all of this absolutely necessary for washing your hands?
Yes, it is, because we want to get to be able to capture every aspect of the hand. So between the fingers, the nails, and at this point we're covering the knuckles, we're covering the nails.
And this is just
Okay.
for healthcare professionals or for everybody?
Everybody, patients, visitors, everybody. So this is the standard procedure for hand washing. So it doesn't matter who you are, if you're a healthcare worker or a patient or visitor, same procedure. Then we go to the thumb. So the thumb, when we were doing when we started off, we did the fingers, so the thumb was left out. So now we are covering the thumb now. We do the other thumb. Then we're going into the nail. We're capturing the nails individually and the tips of the finger. And we're going to switch. Then we're just going to cover just to get the wrist involved, okay? So, and the other.
This is like a 5-minute technique.
This is like 30 seconds.
Okay.
So we're going to wash.
Once you have it done.
You guys seem very familiar with this process. You were doing it along. It didn't seem like it was new to you. This is something that you practice all the time?
Yes, hand hygiene is very important because we have to protect our patient from infection. So it's necessary that we do our hand washing quite frequent before contact with patient, equipment, or whatever the case may be. So it's basically become part of our practice. It's like a second-hand nature. Don't take much effort. Yeah.
You finish drying your hands, we never go back to the top with our bare hands because now the top is contaminated, it's dirty. So the tissue that we've used to dry our hands, that's the one that we're going to use to turn off.
So if pretty much you're in a bathroom that does not have tissue, you recontaminate your hand after the process?
With tissue, you can use a
You're in
towel.
a facility that doesn't have either. You pretty much
Well, you can use your elbow to close, yeah. So you open and you close, okay? But it's always, it's for me, try to be prepared. So once you go in places, walk with some napkins also, so that you don't have to fall into situations where you have to use public bathrooms and don't really have the resources to tidy, because you actually would be infecting, reinfecting, taking germs on you back into your surroundings, right? From the bathroom to your surroundings, where you're going, wherever you're going. If you don't have soap and water, you can use your hand sanitizer. The procedure is the same thing. You have to do the same thing with it. Same steps, same thing you do. Okay? So it doesn't matter if you use the soap and water or the hand sanitizer, it's going to be the same steps that you're going to perform for these things, okay? The only thing with the difference with the soap water and the hand sanitizer is that we always advocate that if your hands are visibly soiled, that you don't use the hand sanitizer, okay? So if you're outside, you're in the dirt, visible blood, um, don't use the hand sanitizer. Go to the top, use soap and water instead of the hand sanitizer.
It's very important, especially because you do so many techniques that actually enter the patient's body. Even if it's taking blood, you put it in an IV. You don't want to infect the patient because you could prolong the hospital stay and then cause the patients to have a lot of complications that could have been prevented. So it's very important that we wash our hands when we should.
Demonstration with one of the medical students to show us exactly how the process is done.
So put some soap in your hands and rub palm to palm. Make a ladder, a rich ladder, so it will help to do the whole procedure. Interlace back of your hands, and you're going to do the same thing on the other hand. Interlace for the hands. You're going to rub the hand over the thumb. On both thumbs. Make a fit, you will fit your finger. And make sure the finger is interlacing the other one, then fold it. And on the other hand, make sure that inside is clean, so you rub it. Fold your hand and rub your finger between your hands. And the other one. And you're going to put your hand on your nose. That's it. And this takes 15 to 20 seconds to wash your hand. You can sing happy birthday while you're washing your hand. It's not too long.